Hello, my name is Kelly Chokanowski, and I want to thank the Bill and Melinda Gates Foundation for taking the time to discuss my proposal. As a program manager, one of my responsibilities is to identify public health issues and work with public health professionals to address them. After much deliberation, I propose that there is no national public health issue more important than the disparity that exists between maternal mortality and race. I was first made aware of this issue through a 2017 case study conducted by NPR. The study addressed that when it comes to maternal mortality, there is a distinct racial disparity, which mostly affects African American women. In fact, the overall maternal mortality rate is 14 per 100,000 live births. The number is 12.7 for white mothers and 43.5 for African American mothers. This is not a new phenomenon, unfortunately, since per trend analysis, while rates in the U.S. did decline between 1935 and 1982, this was mostly for white mothers, and the risk of maternal mortality has remained 3 to 4 times higher among Black women during the past 6 decades. Thus, based on this data, it's clear that African American women in the U.S. are at an unacceptably high risk of maternal mortality. This is due to many contributing factors related to the social determinants of health. First, African American women have unequal access to quality care because they tend to be discriminated against in healthcare settings due to their race. Second, African American women living in poverty experience even higher rates. Also, African American women have limited access to prenatal care. In fact, about 32% of African American women do not attend the recommended number of prenatal visits. Last, there is no current public health policy that specifically addresses maternal mortality in this population. This public health issue can also be examined from different levels within the social ecological model. At each level, there are many factors that either help or hurt the issue. First, at the individual level, the Black Infant Health Program builds life skills, resilience, and relationships in African American women of childbearing age. However, a fear of being discriminated against can often hinder them from seeking treatment in the first place. Second, on an interpersonal level, having a supportive social network is helpful, but being the target of outright disrespect or abuse related to race is a hindrance. Third, on an organizational level, the Alliance for Innovation on Maternal Health has developed maternity safety bundles that promote proper maternal health care practices. However, hospitals that serve predominantly African American populations do not use these and often experience higher rates of maternal complications. Additionally, on a community level, the Black Mamas Matter Alliance promotes maternal care designed for African American women specifically, and raises public awareness about the disparity. However, African American women are more likely to hold minimum wage jobs and thus lack needed health care benefits. Finally, on a policy level, while Medicaid is the largest single payer of pregnancy-related services, the current administration's attempts to both repeal and restrict coverage will mostly negatively impact African American women who are pregnant. However, despite the hindrances, there are some evidence-based interventions that could be solutions. First, the BIH program is a group-based approach with participant-centered case management where women can develop life skills, learn strategies for managing stress, and build social support. They would attend weekly group sessions and work individually with staff to meet their set goals. This addresses the concern over being disrespected or abused in healthcare settings. Second, the mobile reproductive health clinics are medically equipped vans with clinicians who offer reproductive health services like education and checkups for women in low-income areas, which addresses limited access to prenatal services. Last, the maternity safety bundles are protocols hospital staff can follow to ensure African American women are receiving quality maternal care, which addresses the lack of access to services for African American women specifically. Furthermore, as a program manager, I understand that establishing methods to evaluate success is just as important as implementation itself. First, for the BIH program, evaluators will need to verify the target population was reached. This can be done through focus groups after the first 6 weeks of implementation. Improved social support will need to be measured also, which can be done through a survey, including the social provision scale, immediately following program completion. Finally, the outcome measure will determine if there was an increased proportion of full-term deliveries among African American women who participated through a controlled before and after study. Second, for mobile reproductive health clinics, we can measure whether the target was reached through in-depth interviews during the first 6 weeks of implementation. We will also measure if the program increased participants' own mastery of prenatal management through a survey using the Perlin Mastery Scale. Finally, we will use a before-after study with no control group to find out whether preterm births in the target population were reduced because of the program. Finally, for maternity safety bundles, we will measure whether hospital staff followed bundle protocol through document record analysis after the first month of implementation. We will also verify if African American women received the same quality of care as women of other races by comparing patient medical records and performance standards. Last, an interrupted time series design will verify if bundle utilization reduced maternal mortality rates among African American women compared to healthcare settings that did not use the bundles. While these interventions should generate success, there will be some challenges to overcome. First, establishing funds can be addressed by considering sources like Title XIX or Medicaid funds, state health departments, and even potentially sponsorship through local universities, businesses, and charities. Also, having sufficient quality staff available will be difficult, but through racial sensitivity training and professional development, aided by funding, this can be resolved. Lastly, environmental and cultural adaptations will need to be applied to each intervention to account for regional differences in implementation. Furthermore, to properly illustrate my proposal, I have developed this logic model to show exactly how each of these inputs and activities will produce the desired outputs, outcomes, and overall impact. First, if inputs like diverse funding, sufficient staffing with proper training, technical assistance materials that are also educational, and the target community showing engagement are in place, then the activities or interventions previously mentioned will be possible, with certain modifications, of course, to account for cultural and regional differences. Subsequently, if these activities are implemented, they will produce outputs such as reaching the target population and adherence to bundle protocol by hospital staff. Once those outputs are met, the African American women targeted will experience short-term outcomes like improved social support, mastery of prenatal management, and quality care on par with their white counterparts. These will lead to longer-term outcomes like an increased number of full-term deliveries, reduction in preterm births, and reduced maternal mortality rates in hospitals that utilize these interventions. Eventually, these will lead to the overall impact of reducing national rates of maternal mortality and an improved health status among African American women in the U.S. I thank you all for taking the time to hear my presentation today. I provide you with some references that you can use to research for your own records. I hope your foundation seriously considers my proposal and makes solving this public health disparity a priority. Thank you so much, and I hope you have a great rest of your day.